Hello.
Hi.
You said your name is BJ, right?
Fiji, yes.
How are you doing so far?
Good.
So just like I told you, my name is Felix, and we're going to do the head, eyes, ear, nose, and throat examination today. And for the purpose of school, I'm going to upload it for my purpose of grading. Is that okay?
Yes.
Okay. So consent has been given. I'm gonna go ahead and wash my hands. So for the examination, we're going to start from the head, and on the head, I'm assessing for the contour of the head. I'm assessing hair distribution, the texture, it's silk to touch. There are no hematomas on palpation, no hematuria on the scalp. I'm trying to look for any lesions. There's no manifestation of cysts. Everything looks okay. So I'm going ahead to assess for the eyes. On the eyes, I'm gonna see for the facial acuity and facial field for confrontation. On facial acuity is the measure ability of the eye to distinguish objects. And here I'm going to use my Snell's chart. So I'm going to stand 6 feet from the patient and I'm going to assess one eye at a time. So please, BJ, go ahead and close your right eye for me. Now read the last one from the right side to the left side, please.
LTFPH.
All right, the right eye, OD, is 20/20. Go ahead and close the other eye, please. Now read from the right side to the left side, please.
LTFPH.
Thank you. So OS is 20/20. Now both eyes.
LTFPH.
All right. So OD, OS, OU is 20 out of 20. And now we're going to assess for the facial field. So this is the portion in space where my patient is going to be able to see objects at the same time. So we're going to go eye by eye, okay? So close one of your eyes, please. And you tell me when you see my 2 fingers, okay? You say now and point where you see, okay?
Now.
You point at them. Thank you.
Oh, no, no,
No, not yet. So we're going to do the 6 cardinal point of gaze, okay?
Now. Now. Now.
Thank you. The other eye.
Now. Now. Now.
Thank you. Now both eyes.
Now. Now. Now.
Perfect. So now we're going to see inspection of the eyes. Under inspection of the eyes, I'm looking at its photalmos, which is the protrusion of the eyeballs. As you can see, they are not ptosis, which is the drooping of the eyelids. They are not drooping. And I'm looking at the conjunctiva. It's not pale. It's pink in color, which is expected. I'm gonna look for the sclera, which is the whitening of the eye. It's all good. I don't see any abnormality with it. So we're going to do the fundoscopic examination. No, before that, we're gonna check for the lacrimal glands. I'm going to squeeze the medial currents against the nostril. There's no discharge coming out, so it's normal.
Okay.
Don't worry about it. So we're going to do the fundoscopic examination. In here, I'm using my ophthalmoscope. I'm about to confuse the ear with the eyes. So the technique in observation of the fundoscope is the right hand, it's going to observe for the right eye, okay? And I'm going to use my right eye for the right eye, okay? All right. So go ahead, let's see. So what I'm looking for is the cornea. I can see the macula is regular and sharp. The ratio, the cap, this ratio is 1:3. There's no heavy nicking, no cotton ball observed. I can see the fair. There's no hemorrhage. Blood vessels looks normal. I can see the cornea. The macula is regular and sharp. These two cap ratio is 1:3. Oh, okay.
No, you're fine.
Okay, one more time. Okay, just gaze at me, please. These two cap ratio is 1:3. There's no heavy nicking. There's no cotton ball. And let me touch my light, please. I can see the red leaflets. I forgot to check on the red leaflets on this side, please. Yes, I can see my red leaflets. So we've been able to see the red leaflets on both eyes. In both eyes, I'm able to see the macula. It's sharp, regular, which is normal. This cap ratio is 1:3, and both eyes there's no heavy nicking. Okay, looks good. And that's what we call the curtain. So, could you go ahead and smile for me? Expose your teeth for me. Can you frown? Buff. So here I'm looking for facial symmetry. Cranial nerve number 7. It's intact. I'm gonna check for my TMJ, tendomandibular joint. Go ahead and clench your jaws for me. Push it forward, the jaw forward. And here I'm assessing for mastication muscles, and I'm assessing for cranial nerve number 5. So the next part I'm going to observe is for the ears. And ears on assessment, I'm checking at the auricles. Do you feel any pain?
No.
On the pinner, there's no tenderness. There are no lesions. From the outside, no exudation. There's no discharge. Same case here, the pinner. It's so symmetrical. No discharge noted. On the triggers, do you feel any pain?
No.
On palpation of the triggers, any pain on it? On this side? So no pain. So I'm going ahead to use my otoscope. So the technique, on using the otoscope, I'm gonna have a firm grip, and my last finger, the little finger, is gonna be against the face of my patient, and my other hand holding firmly. So if she moves, it's gonna move with me, so I don't have to cause any trauma on my patient. So I'm gonna pull the pinner backward and up. The ear canal is clear. There's no discharge. The ocular, the maxillary. I can see the tympanic membrane is translucent.
Is that the only one that's been particular line other than the
On 5 o'clock,
other than herbs?
It's a lot of wax.
I can see the cone of light on 5 o'clock. So we're gonna assess for the left ear. The ear canal is clear, there's no wax. I can see the tympanic membrane, it's translucent. The cone of light is at 7 o'clock. Looks normal to me.
Good.
Yeah.
Thank you.
So, next we're going to the nurse. So, before that, I'm gonna, on the ears, I'm gonna test for auditory acuity. And then we're gonna check for cranial nerve number 8, the auditory, okay? So I'm gonna have you close your eyes and tell me what you hear, okay? And what side of the ear you hear, okay?
1, 2, 3.
Which side of the ear?
Right.
Okay.
1, 2, 3 on the left.
So I'm using the whisper test to test for the hearing, and she's able to get it. So next I'm going to test for the Rhine and Vapor test, and here I'm going to use my tuning fork, the 512 tuning fork. Here we're going to test for the air conduction and bone conduction. Okay? Oops, sorry. So, where do you hear the sound?
Are we saying what we heard?
Oh, there.
No. Which side of the ear do you hear
Oh,
the sound?
the right.
You know, because usually we're supposed to say our
Okay, one more time.
So I'm like, are we gonna say S1 and S2? Maybe I'll just say that then S1, S2
Oh,
heard
both.
in all
Both
areas
ears.
of the heart.
Both ears?
Yeah.
Okay.
No murmur.
Are you sure
Yeah.
it's both ears?
Both ears, yeah.
Okay.
So,
I'm going to place it on the mastoid. I'm testing for the bone conduction. Tell me when it stops, okay?
Stop.
Are you able to hear it?
Yes.
Okay. Tell me when it stops.
There.
Are you able to hear it?
No. Do it again. There.
Are you able to hear it?
No. I think it's Yes.
Tell me when it stops.
Yes.
Are you able to hear it?
Yes.
So this shows that AC is greater than the BC. Air conduction is always greater than the bone conduction, okay? So we've assessed the head, we've assessed the eyes, we've assessed the ears. Now we're gonna assess for the nose, okay? Under the nose, I'm gonna see the symmetry of the nose. It's symmetrical. Then I'm observing for any external discharge. There's no external discharge. And I'm gonna go ahead and assess for patency. So go ahead and close one of the nose. Breathe in, out. Go to the other nose. Breathe in. So the patency is okay. There's no airway obstruction. Now we're gonna test for the smell. Go ahead and close your nose, and I'm gonna tell, and you're gonna tell me what you smell, okay? So close one of the nose, please. Smelling. What do you smell?
Alcohol.
Okay. Close the other nose. What do you smell?
Alcohol.
Okay. You ready? Close one of the nose. What do you smell?
Coffee.
Thank you. The other nose. What do you smell?
Coffee.
All right. And here we testing for cranial nerve number 1, the olfactory. Sense of smell is good. The hair with patency is okay. Now we're gonna go ahead and assess your mouth, okay?
Or is that, oh, it's here. So you might, I mean, you can probably do it there. When you're looking at other areas, I'm also checking for tab refill. Like, I'm gonna also check for the whole refill. You might as well just do it all there, you know. 2+ brisk and strong cold.
So I'm going to expect to assess for the mouth. And externally, I'm assessing for any inflammation. The lips are symmetrical. They were like hydrated. There's no lip cracking. Go ahead and open your mouth for me, please. So I'm looking for the buccal cavity. It's pink. There are no patches, there are no lesions. I'm looking at the gum for gingivitis. There's no inflammation of the gums. The teeth, they are all well aligned. There's no missing teeth. Dental hygiene is good. Stick out your tongue for me. Push it against my blade. And up. And here we are assessing for cranial nerve number 12. Can you say ha? I'm looking at the ovular. And here I'm assessing for cranial nerve number 9 and 10. I don't want to initiate any gag reflex at this point. I'm looking for, lift up here, for the glands. I'm very careful. My patient not to spill saliva on me. The tonsils are not enlarged.
I'm doing this on my husband, so
And the examination looks normal to me.
Thank you.
Right. So next,
yeah, car stains on fingers.
we're going to assess for the neck. And on the neck, it's symmetrical. And right now we're going to check for the glands. So in the here, I'm checking for the enlargement of the tonsillar, lymph nodes. There's no enlargement. Submandibular. There's no enlargement. Submental. There's no enlargement. Preocular. There's no enlargement. Postocular. There's no enlargement. The hospital. There's no enlargement. Go ahead and flex. Okay. Go ahead and extend your backwards. Okay. On to your right. Your right.
Oh, my right.
Lateral rotation. Your left rotation. Go ahead and turn it around through the rotation. Any pain?
No.
So, flexion, extension, lateral rotation, it's normal. There's no abnormality noted. Now we're going to assess for the thymus gland. And at the beginning of the Adam's elbow, that's my thyroid cartilage. When I come down at the end of the Adam's elbow, that's my cricoid cartilage, and in between, that's where we have the thyroid gland. Okay? So I'm going behind the patient to assess for any enlargement. So I'm gonna use my left hand to press a little bit to feel for it on the right side. There's no enlargement. I'm have my patient to lean on my right side, push a little bit to feel for it. There's no enlargement. Now go ahead and swallow for me.
I mean, I'm guessing like with this.
There's no enlargement. And that marks the end of our head, ear, eyes, and nose, throat exam. Thank you so much for your
Thank you.
cooperation and thank you so much.
You're welcome.
All right.